Medical methods of medieval times. They're gonna make you cringe. Let's get into it. Starting off this list today with perhaps one of the most disgusting medical practices from history that I could have possibly found: enemas. Enemas have a surprisingly rich and, dare I say, colorful history, especially in medieval times. Back then, the go-to tool for this somewhat intimate procedure was known as a clyster. Picture a long, shiny metal tube with a little cup attached to one end. The device was designed to be carefully inserted into a patient's behind, after which a special medicinal fluid would be poured into the cup. The fluid was then gently pumped into the cavity, often through a somewhat rudimentary and, by today's standards, crude method. In modern times, we've definitely heard of some interesting holistic approaches, but medieval concoctions were far from what we'd consider pleasant. One of the more eyebrow-raising substances used as a fluid was boar's bile. That's right, boar's bile. This earthly mixture was believed to have potent medicinal properties, even if it might not be the first choice for a spa treatment today. And the use of enemas wasn't just limited to common folk. It was practiced and even endorsed by royalty. King Louis XIV of France, known for his extravagant lifestyle, reportedly had a particular fondness for clysters. During his reign, it is said that he underwent more than 2,000 enemas, and in true royal fashion, some were even administered while he was seated on his throne. When it comes to wounds, most of us would prefer clean bandages and antiseptics over squirming insects, but of course that wasn't always the case. In fact, it used to be that the go-to thing to slap on a cut or a nick was maggots. Yes, maggots. Those tiny wiggling larvae have been quietly saving lives for centuries through a procedure known as maggot therapy. This practice, which may seem like it belongs more in a horror movie than a hospital, actually has roots stretching back to ancient times. The earliest mentions appear in the Book of John in the Old Testament. Fast forward to the American Civil War, and you'd find doctors deliberately applying maggots to soldiers' wounds to clean out dead tissue and fight off infections, a method that proved remarkably effective on the battlefield and remarkably nauseating in my brain. In the Middle Ages, treating cataracts was not for the faint-hearted. Surgeons used a thick needle to displace the clouded lens from the line of vision by literally pushing it back into the eye, a method known as couching. This rudimentary and rather terrifying approach often led to complications and less than perfect results. However, the tide turned when Islamic medicine began to leave its mark on Europe. Islamic scholars and physicians introduced more refined techniques. They pioneered the use of a metal hypodermic syringe inserted through the white part of the eye. This syringe was used to suction out the cataract, offering a far more precise and less invasive alternative to the needle, although it still sounds absolutely horrific, personally. Next up, Radithor. Radithor was marketed as a miracle drink from the early 20th century, which was a period rife with outlandish medical claims. The brainchild of William Bailey, a Harvard dropout. Radithor was marketed as a health tonic containing radium. Bailey touted it as a cure-all, promising it could treat everything from cancer to anemia and even depression. The notion that radium had healing powers wasn't just Bailey's fantasy though. It was a widespread misconception. People thought that radium in natural spring water was responsible for its health benefits, and this belief quickly led to the commercialization of radioactive products. To ensure that they were getting the freshest radium, some even purchased devices to add it directly to their drinking water. The enthusiasm for these supposed health benefits reached its peak with Ibn Byers, a wealthy industrialist who consumed Radithor in enormous quantities. By the time the devastating effects of Radithor became apparent, it was too late for Byers. His jaw and bones were severely decayed, his brain was riddled with abscesses, and his skull had literal holes in it. Byers' tragic death in 1932 highlighted the dire consequences of unchecked medical quackery. His remains were so radioactive that he was buried in a lead-lined coffin, a grim testament to the dangerous allure of Radithor. Speaking of holes in the skull, if you didn't like that one, this one won't be much better. Trephination, one of the most ancient and unsettling medieval practices, involved drilling a hole into a patient's skull. Imagine lying there as a surgeon scrapes away at your head with a sharp stone or rudimentary tool. It's truly the stuff of nightmares. Yet this gruesome procedure was believed to be an important treatment in ancient times. People thought that trephination could expel evil spirits, which they believed were the cause of various ailments like headaches, infections, and even seizures. It also served as an early attempt to fix skull fractures. As time progressed, so did the methods. From using sharp stones to the advent of primitive drilling tools that could carve small, precise circles into the bone, ancient physicians continued to refine their techniques. By the medieval period, more advanced mechanical drills and saws emerged, making the process somewhat less barbaric and just a bit more controlled. Despite its horrifying origins, trephination's principles continue to underpin critical neurosurgical procedures, albeit in a much less traumatic and much more refined manner. Next up, we have Vin Mariani. If you think this medical practice sounds like a type of wine, well, you're kind of correct. Vin Mariani was a tonic wine, essentially a glass of red wine with a little medical twist. It was mixed with, well, let's call it booger sugar. That's right. The medical concoction was basically an express ticket to a wild night and a quick death. Except it wasn't meant for a good time. It was prescribed to men who were overworked as some kind of weird Victorian-era energy drink, invented and sold first in 1863. The medical concoction continued to be made into the 1900s as a form of nervous system stimulant, and no wonder, considering the extremely high dose of that illegal nervous system stimulant we just spoke about. The idea was to drink a couple glasses of this mixture throughout the day to maintain a healthy nervous system. I'm sure it worked just as advertised, but with the unfortunate side effects of addiction to both of the items in the tonic, possible overdoses, and death. It's pretty difficult to refer to this as medicine. It's illegal today, so that should tell you what you need to know. Next up, there is a procedure called a glossectomy that involves the procedure of removing a person's tongue. This already absolutely sucks, but what might be worse is the historical treatment of hemiglossectomy, which is the removal of only just part of the tongue. This treatment was used in history to improve stuttering and speech impediments, which would have been amazing if it wasn't for the really common side effect of death. Johann Friedrich Diefenbach, a German surgeon, had a habit of using this method, cutting patients' tongues down to size, you know, a little off the top and the sides, until it was deemed illegal after too many people died during the procedure. Definitely not the intended outcome. It turns out that this was a lot more like a punishment than it was a treatment, especially for someone already dealing with someone with something like a stutter. Thankfully, we use much more sensible treatment today, such as speech therapy, which seems to have a much lower death toll. Throughout history, there have been a lot of medical practices carried out on the battlefield, but some have definitely been more gruesome and cringeworthy than others. Back in medieval times, battlefield medicine was truly as horrendous as it gets. Imagine the chaos of a medieval battlefield with arrows raining down, arrows designed to be even more vicious than the ones used for archery today. You see, arrowheads in this time were commonly attached to their wooden shafts with wax, a sneaky trick so that when someone tried to pull the arrow out, the head would break off and remain lodged in a person's flesh. To tackle this, medieval medics invented specialized tools known as arrow removers. These clever devices were crafted to grasp the embedded arrowhead and extract it from the wound. Basically rip it out, boom, out of the body. It's a procedure as excruciating as it sounds. Once the arrowhead was out, the wound was cauterized using a red-hot piece of iron burned onto a person's skin. This not only stopped the bleeding, but it also helped prevent infections in an era long before antibiotics. Though medieval medicine often gets a bad rep for its rudimentary methods, there's evidence suggesting it wasn't entirely primitive. In 2011, archaeologists uncovered a set of bones in Italy dating back to the early medieval period, 500 to 700 AD, that revealed surprising medical prowess. One of those skeletons showed signs of surviving a severe head injury that was a gaping 5-centimeter hole in the skull. This remarkable survival indicates that early medieval healers might have had more advanced medical skills than we give them credit for. They were dealing with injuries that could floor a modern-day warrior, and somehow, against the odds, their patients lived to fight another day. Before the era of modern antibiotics and chemotherapy, treating tuberculosis was a daunting challenge for doctors. One of the more extreme measures employed was Plombage was Plombage Thoracoplasty, a method designed to intentionally collapse part of the lung to give it a rest and facilitate healing. This treatment, which came into use in the 1930s, involved creating a space under the patient's upper ribs and then filling this cavity with various materials like paraffin wax, rubber sheets, or even ping pong balls, which is a thought that actually gives me goosebumps. The idea was to apply enough pressure inside the body to keep the infected lung from inflating. While the concept might sound innovative, not to me though, the results were often drastic, not in a good way. Patients frequently faced severe complications, including infections, issues with their heart and esophagus, and sometimes even skin problems, and of course death. By the 1950s, the high risk of these complications led to the decline of the treatment. Only a handful of patients survived long after their procedures, mainly from the last wave of individuals to undergo the treatment. Today, though it's rarely used, it does still appear in some cases for treating a condition where pus gathers in the chest cavity. How lovely. And finally, we have Primal Therapy, which is basically a practice in which a patient, along with their psychiatric physician, would reenact or relive a traumatic or life-changing event that they are trying to work through. They would essentially be re-experiencing the event through memory in a safe space where they are able to move through the motions of their feelings and let out whatever they need to get out. And when I say let out, I mean it. The primal part of this therapy comes with the intense guttural scream you are meant to let out as part of the treatment, as loudly, angrily, and cathartically as possible. Patients are instructed to scream out all the thoughts and feelings they have experienced while reenacting their traumatic experiences. Honestly, while it might sound a bit cringeworthy compared to the other things on this list, it doesn't sound all that bad. If this room was more soundproof, I might give it a shot right now. But if you're wearing earbuds, I don't want to be responsible for causing you damage to your eardrums. While the practice is definitely different from traditional therapies, it also encourages people to utilize punching bags and tells them to roll around on the floor, it's still practiced in some settings today. The screaming, not the punching. Despite the method being widely discredited by scientists and psychologists alike, primal therapy lives on in some more eclectic practices in modern day society. Alright you guys, those are some pretty medieval, pretty gross treatments that you would have seen back in the day, back in history. I hope you enjoyed it. If I missed any, let me know down below. I've been your host, Hannah Thompson. Together, we are keeping the past present.